Here's a real one. A woman on Medicare went in for her annual physical, got a shingles shot while she was there, and walked out having paid $200 for that single shot. She wasn't wrong to think Medicare should have covered it. She was just missing one piece of paperwork nobody had explained to her, and that $200 mistake is happening to people across the country every single week on a benefit that has been completely free since a law changed back in 2023. That's the pattern I want to show you today, not bills Medicare refuses to pay. Bills Medicare already agreed to pay, in full or almost in full, that people are still handing their own money over for anyway, because the free version has a specific name and the wrong version doesn't. Say the wrong words to the front desk or skip one small step when you enroll, and you get quietly routed onto the path where you pay. Say the right words, and the exact same service costs you nothing. And 2026 is genuinely a good year to be checking this, because a few of these expanded recently. Vaccines that used to cost Medicare recipients real money became fully free in 2023, and most people still don't know it. The rules around colonoscopy screenings have been getting less expensive every single year since 2023 and keep improving through the decade. If you last looked into any of this a few years ago and walked away thinking it wasn't worth the hassle, some of the math has changed since then. By the end of this, you'll know 6 specific services Medicare is already paying for, the one word or one form that unlocks the free version of each, and why none of this shows up on a bill that just says covered in plain English. Number 1, the visit that looks like a physical but isn't billed like one. Every year, Medicare will pay 100% for what's called the annual wellness visit. And if it's your very first year on Part B, there's a separate one-time version called the Welcome to Medicare visit that's also completely free. Both have zero copay and the deductible doesn't apply. The mix-up happens because people expect this to feel like the physical they got through a job, with a full hands-on exam, and when it doesn't feel like that, they assume it wasn't the real benefit and go book a private physical instead, which can run anywhere from $150 to $500 out of pocket. The fix is just knowing what to ask for by name. Call your doctor's office and specifically say, Annual Wellness Visit, or, if it's your first year, Welcome to Medicare Visit, not checkup, not physical. Those 2 exact phrases are what get it billed correctly. Number 2, the shot that used to cost real money and now doesn't, unless you're missing one piece. Since January of 2023, every vaccine recommended for adults by the CDC's Vaccine Advisory Committee, including the shingles vaccine, has been completely free with no copay and no deductible for anyone with Medicare drug coverage. That's not a small thing. Before that law, people were regularly paying $50 to $200 just for the shingles shot. Here's the catch. Nobody explains well that free coverage lives under Part D, your drug plan, not Part B, your medical plan. If you have original Medicare with no separate Part D drug plan attached, or if your doctor's office bills the shot the wrong way, you can still get charged. So before your next vaccine, the one question that matters is simply, will this be billed through my Part D plan? If the answer is yes, you should be paying nothing. Number 3, the second opinion you probably assumed Medicare wouldn't touch. If a doctor recommends surgery or a major procedure, Medicare Part B covers you getting a second opinion from a different doctor. And if that second doctor disagrees with the first, it covers a third opinion too. A lot of people never ask for one because they assume Medicare only pays for the doctor who's actually doing the surgery. So they either skip the second opinion entirely or pay for one completely out of pocket, which for a specialist consult can easily run $300 or more. The reality is, you pay the same modest coinsurance you'd pay for any other Part B office visit, nowhere close to the full private rate. If you've ever been told you need surgery and quietly decided not to double-check because you thought it wasn't covered, that assumption was costing you money. Number 4, the dietitian visit that's free, sitting right next to one that isn't. If you have diabetes, kidney disease, or a kidney transplant within the last 3 years. Medicare covers sessions with a registered dietitian called medical nutrition therapy at 100%, no coinsurance, no deductible, full stop. There's a second related benefit called diabetes self-management training that does have a small coinsurance attached, and the two get confused with each other constantly. What actually happens is people who qualify never ask for either one and instead pay privately for a nutritionist, not realizing one of the two versions Medicare offers is entirely free. The move here is simple. Ask your doctor for a referral specifically for medical nutrition therapy, and if you have diabetes or kidney disease, you very likely qualify. Number 5, the home care that can cost you nothing if it's ordered the right way. Private home care, someone coming to help after a hospital stay or a fall, commonly runs several $1,000s a month out of pocket. But if a doctor certifies that you're homebound and orders skilled home health care, meaning nursing visits, physical therapy, occupational therapy, the kind of care that requires a licensed professional, Medicare covers that at 100%. Zero copay, zero deductible, for as long as the skilled need continues. The confusion is that this only covers the skilled part, not someone just helping you get dressed or make meals day to day, and a lot of families assume that distinction means none of it is covered, so they arrange and pay for private help without ever asking a doctor to write the order for the skilled version first. If you or a parent is coming home from a hospital stay, that order is the one sentence that can turn a several $1,000 month into a free one. Number 6, the screening people skip because of a bill that mostly isn't real anymore. A screening colonoscopy is completely free under Medicare if the doctor accepts assignment and nothing concerning is found. The fear that keeps people away is what happens if they do find and remove a polyp while they're in there. For years, that flipped the whole procedure into a bill you'd actually owe a real coinsurance on. And plenty of people who heard that story decided screening wasn't worth the risk and skipped it entirely. Here's what's changed. That coinsurance has been shrinking every year since 2023 under a federal phase-down, sitting at 15% through 2026 and heading towards zero by 2030, and the deductible never applies to this situation regardless of the year. Skipping a cancer screening because of a bill that's already smaller than most people think and getting smaller every year is a trade nobody should be making without knowing the real numbers. Now look at what ties all 6 of these together, because it's different from the usual story about government benefits. This isn't about missing paperwork or missing a deadline. Every one of these is already active on your Medicare card right now. What decides whether you pay is a single word, a single form, or a single referral, said or not said, at the exact moment you're sitting in front of the person doing the billing. Say physical instead of annual wellness visit, and you get billed. Get a vaccine without confirming it runs through Part D and you get billed. Assume a second opinion or a nutrition referral isn't covered and never ask, and you never find out otherwise. The system isn't hiding these behind 10 pages of forms. It's hiding them behind 10 words most people never think to say. So here's what I do with this. Before your next appointment, write down 2 phrases: annual wellness visit and, if it applies to you, medical nutrition therapy referral. Say them out loud to the scheduler. Before your next vaccine, ask the one question about Part D. Before you turn down a second opinion, remember it's coinsurance, not a full bill. You don't need to memorize all 6 today. You need to say the right words once. And if you know someone who paid $200 for a shingles shot, or quietly skipped a colonoscopy because they were scared of the bill, or hired private home help without ever asking their doctor for an order, send them this. The coverage was already there. Nobody ever told them which words would have made it free. Thank you for watching.